Okay, everyone, this is Dr. Darvish, and I would like to welcome everyone. Thank you so much for joining us today. I'm hoping that there's no reverberation going on because I'm hearing some things, but hopefully not. Today we're talking about men's health and testosterone, and I'd like to welcome Dr. Justin Newell, who will be presenting, and I will join him in the midst of it for a little bit. So Dr. Newell, take it over. Thank you.
Great. Hey. Well, welcome everybody. Nice to be doing the second one of this. And today we're going to be talking about men's health, and we'll go and dive into many different men's hormones, but specifically we're going to be diving into testosterone and how that affects men early in life and actually in later life as well. But I'm just kind of going into the leading causes of death among adult men. Heart disease, number one. Cancer is a big one. Unintentional injuries, that might not surprise many people out there. Chronic lower respiratory disease, and also stroke are the leading causes of men right now in young adult men. So what can we do about this? And we're going to start talking about some lifestyle changes here. We're going to dive in a little deeper about how lifestyle can affect testosterone later in the slide set. But as it relates to the top causes of death among young adult men, what can we do? So first thing right off the bat, healthy diet. You've probably heard this before. We're going to focus on eating a diet high in vegetables, fruits, whole grains. We need high fiber foods for good gut health and lean sources of protein. Another big one that might not surprise some people, exercise and weight loss. Very, very important here. We want to maintain a nice, healthy weight. And what does that mean? So belly fat is classified can be broken down into two different types. So the first one is subcutaneous, which is just under the skin. And the second one is visceral. And that's the fat that's behind the abdominal wall and around the organs. Visceral fat is the one we want to focus on because that one is more dangerous. It increases your risk of cardiovascular disease, diabetes mellitus type 2, other health conditions, and also osteoarthritis as well. Well, when we focus on diet and exercise at the same time, what does this do? This lowers our risk of cardiovascular disease and stroke, and also boost our immune system. So we're getting overall health and wellness and kind of just focusing on the body as a whole. And the interesting thing, just people that focused on diet and exercise alone. So patients who lost, and this was a recent study that I pulled this from, patients who lost about 5 to 10% of their total body weight showed reductions not only in triglycerides, but also in total cholesterol, LDL, and they had an increase in HDL. Another recent study I was pulling over while preparing for these slides, just 15 minutes a day of exercise. 15 minutes, 3 times a week, increased total testosterone levels in the body. And we're going to dive into a little bit more of the exercise a little later in the slide set as well. Another big one, alcohol consumption and avoiding the smoke. So if you do choose to drink, do so in moderation. 2 drinks a day for men 65 years of age or older is the recommended amount for moderate drinking. One drink per day if older than 65. That's the recommendations for men for moderate drinking. And just some examples of drinking. 1 drink, 12 fluid ounces of beer, 5 fluid ounces of wine, and 1.5 fluid ounces of hard liquor. So too much alcohol actually increases our risk of various different types of cancer. And also our cancer, the chances of men getting cancer actually increases the amount of alcohol they drink, and as well as the length of time you're drinking for. So maybe 5, 10, 15 years, if you continue moderate or heavy drinking during that time, your risk of cancer and cardiovascular disease and stroke actually increases over time. Another interesting fact is too much alcohol can increase blood pressure, and that's kind of going back to the cardiovascular disease. It increases your risk of heart attack, stroke. And so if we do so in moderation, we want to definitely limit our alcohol and avoid smoking altogether. Smoking, not only doing it yourself, but we want to avoid exposure to secondhand smoke as well. Air pollution and chemicals also increase risk of cardiovascular disease and chronic lung disease. So we just want to be aware of those things. And another thing is managing stress. So this is hard in today's world. We all have deadlines we have to meet. We all have projects that are due. We're such in a go, go, go society. It can be tough to manage our stress, but just some simple techniques right off the bat, relaxation techniques like meditation or deep breathing. We can also manage our stress by just taking a break from a stressor or project or whatever it may be. Just walking away, take 5, 10, 15 minutes away from that stress, kind of reset, kind of get out of that parasympathetic state and go back more into a parasympathetic state, which is going to help you rest and digest. And instead of the sympathetic state, which is the fight or flight response, that epinephrine release, that go, go, go. If we were being chased by a bear or we had a deadline that is due, we want to avoid that sympathetic state, try to get back into that parasympathetic state. There's also a lot of great support groups out there that help people deal with stress, whether it might be talking about it, pinballing different meditation and relaxation techniques. But once we start to focus on that parasympathetic state and try to get into that and start managing our stress in a healthy way, it actually helps to improve mood as well and decrease your overall anxiety. It also helps, and I talked about this with Dr. Morella a couple of weeks back, it also helps to manage acute and chronic pains, which is pretty fascinating. All right, now we're just going to jump into testosterone here. I mean, there's a lot, like I said before, there's a lot of different hormones that are going on in the body, but I just chose for men's health just to focus on testosterone. And so let's just dive into it. What is the role of testosterone? Testosterone is the major sex hormone in males and plays many, many, many important roles. Some of the main ones, though, are the development of the penis and the testes, deepening of the voice when you go through puberty, starts to get the appearance of facial hair, increases in muscle size and strength, also increase in bone growth and strength. Really influences our sex drive and libido, and also sperm production. So let's just hop into how testosterone is regulated. So what's going on here? So the brain is sending signals to the pituitary gland, and we can kind of see in this chart over on the right-hand side that where the hypothalamus is sending, that's in the brain, sending signals to that pituitary gland, and then the pituitary gland relays signals to the testes to produce testosterone in men. And this feedback loop, we call it a negative feedback loop, is closely regulated to the amount of hormone, aka testosterone, in the blood. So when our testosterone levels rise too high, our brain sends signals to our pituitary gland to reduce the production of testosterone. So like I said before, this is a very tightly regulated feedback loop, and testosterone is actually synthesized in the body from cholesterol. But kind of going that diet piece one more time, having high cholesterol doesn't necessarily mean you're going to have high testosterone. It's actually more or so regulated by this feedback loop.
Can I add one other thing in there, Doc?
Yeah, absolutely.
So one of the other reasons we have to be careful with testosterone supplementation is that if you get too much testosterone, it's going to actually shut down the signaling in the brain and the pituitary, and as a result, it can impact other hormones as well. So men and females who don't necessarily need testosterone and they're taking testosterone, they're actually messing up with a lot of other hormones. That's why it's very, very important to keep a good tab on testing some of these hormones so that we're not messing up anything else.
Absolutely. Just we're going to talk about both elevated testosterone levels and low testosterone levels, and we're going to focus more on the low testosterone levels and kind of some naturopathic treatments and some of the conventional treatments that are out there, just so you get a good idea of what there is to offer. But some of the symptoms of high testosterone levels, actually, we're going to have shrinking of our testes. We're going to increase risk of erectile dysfunction. Our prostate actually starts to enlarge, and some of the symptoms of that are difficulty with urination. Increased risk of liver disease. Acne starts to come on the face and the upper back and the shoulders. We have increased blood pressure and cholesterol. Insomnia is a big one. And but as you know, with increase in testosterone, you're going to have increased muscle mass and increase in bone size and density. So just hopping into more of the low side of testosterone. So there are two types of male hypogonadism, which is just a fancy medical term for low testosterone levels. We have primary, which that's where the problem is actually originating in the testes. And some of the examples of this are primary testicular failure. Some of the causes of this can be genetic, undescended testes from fetal development, hemochromatosis, which is just too much iron in the blood, and then just direct injury to the testicles themselves. And then secondary male hypogonadism is where the problem actually originates in the hypothalamus, so that brain region, kind of on that 2 slides back, or in the pituitary gland. And some of the causes of this can be HIV, AIDS, pituitary disorders. Medications actually is a very big one, opiates in particular, and obesity. So some of the symptoms of low testosterone we kind of talked about before. We're going to have reduced body hair, reduced facial hair, loss of muscle mass, start to experience low libido, low sex drive, erectile dysfunction. We're going to have reduced sperm counts. Men also start to experience increase in their breast size and sometimes tenderness with that. Hot flashes, start to receive some neuro disorders like poor concentration, depression. There's also an increased risk of fracture because you start to develop brittle bones. So what is going on? What is causing these things in the body to happen? What's happening? So the testes are starting to produce less testosterone. And why is that? Because there start to become fewer signals from the pituitary telling the testes to make testosterone. There's also an increase in a protein called sex hormone binding globulin that increases when you age. High levels of this sex hormone binding globulin are associated with infertility, low libido, and erectile dysfunction. And actually, it binds free testosterone in the blood. So free testosterone levels will be lower. And actually, as men age, testosterone levels drop very gradually, about 1% to 2% a year at the age of 30. So you tack on some of your increased risk factors, drinking, not working out, sedentary lifestyle, not managing your stress, and the fact that after 30, they're dropping 1% to 2% a year, your testosterone levels can really be taking a hit. So we just need to be aware of that.
Stations come up for section 54.57. Been here technical goal for
Dr. Darvish, is there anything you want to add? Dr. Darvish? Okay, I'll continue going here. So how are we going to diagnose low testosterone? So according to the American Urological Association, total testosterone levels in the blood are got to be under 300 nanograms per deciliter. Also, there's quite a bit of leeway in what is normal, a normal range for men in testosterone levels. So we also want to take into account low testosterone levels in the blood combined with signs and symptoms, as we talked about earlier, low sex drive, low libido, erectile dysfunction, decrease in muscle size, decrease in facial hair, maybe increase in the size of the breast. So we need both the signs and the symptoms as well as the blood levels to be low. We want 2 total testosterone measurements taken on separate occasions. We want both of those measurements to be taken in the morning because that's typically when men's testosterone are the highest. And also it's important that when you have these blood measurements taken that they're not sick, because that can actually throw off the blood results and lead to lower than average total testosterone levels. Your doctor could do a little adjunctive testing, blood hemoglobin, blood prolactin levels, luteinizing hormone to actually find the cause of why the testosterone is low in the first place. Something that we offer here at Holistique is something called the Dutch test. And Dr. Darvish, do you want to dive into a little bit deeper?
First of all, if you are getting just the blood test done, I like to see the numbers over 550 rather than just the conventional numbers of less than 300. So 550 is where and up is where we find most men function better and they feel better. So that also includes memory and mood is more stable. They're not as impulsive, short-tempered, and they just feel better in their body when it's over 550. So the Dutch test is a urine test that we often run in combination with the blood work to look at all the other steroid hormones, such as the estrogens and the DHEA, progesterone, and all the metabolites that go along with it, along with B vitamin 12 and B6 and glutathione and some of the neurotransmitters. And what these tests show us is how all of these hormones are interacting with each other, and do you have enough of the building block like the DHEA or the pregnenolone to be able to make testosterone on your own? Do you have enough of or too much of cortisol, which can actually suppress testosterone when you're in that fight or flight response? So it's really very important to look at that. On the blood work, I also look at thyroid, which is one of the main hormones that sits right here in front of your throat, in front of your Adam's apple. And the thyroid has quite a dramatic effect on the testosterone production. And so many men may be actually low in testosterone or low in their thyroid function, and it's causing the low testosterone. And they can take testosterone as much as they want. They won't quite feel as good unless the thyroid is affected. By the way, I was just looking over some of the studies this morning regarding thyroid and testosterone, and the electromagnetic fields from cell phones and computers, they're finding even just 15-minute usage of a cell phone will decrease thyroid function, which leads to decrease in many of the other hormones. So be aware of the usage of the electromagnetic fields. Right now, especially cell phones, as we're trying to social distance, but our usage of electronics has gone up. So do be aware of that and keep a tab of how much you're actually utilizing these tools.
Thank you, Dr. Darvish. So just going into the conventional treatments, and then we'll hop into the naturopathic or natural treatments for testosterone. Some of the most common ones you're going to see out there, topical, transdermal. These include creams, gels, patches. These topical medicines most often last around 4 days and absorb directly through the skin. Injection is a pretty popular one. We have both short-acting and long-acting forms. Injections are given straight into the muscle tissue. And they're done either weekly, every 2 weeks, or monthly, depending on the form or if it's long acting or short acting. Pellets is another one you might have heard of. They're just placed under the skin, usually in the upper hip or the buttocks area. And this medication or the pellets dissolve slowly over time, in typically about a period of 3 to 6 months, depending on the number of pellets that are actually placed under the skin. Some of the other ones you might see out there are oral, intranasal. I'm not a giant fan of these. Oral's pretty liver toxic, and there's an increase in liver enzymes you'll typically see with that. Intranasal is not one you see out there often, but usually the first 3, topical, injection, and pellets, are the most common.
Just to add to that as well, thank you, Dr. Newell, is that we tend to not use as much of the injections because these are mostly synthetic, as are the gel forms of the topical. And the synthetic forms of testosterone tend to increase the risk of prostate-related or hormone-related cancers, as well as some other inflammatory conditions. So what we end up using is mostly the topical, which we formulate as a bioidentical, as well as the pellets, which are the size of a grain of rice and are inserted right underneath the skin. And like Dr. Newell was mentioning, they can last anywhere between 3 to 6 months, depending on how fast your body's utilizing them based on your stress level and the other nutrients and detoxification system. So the ones that we really like are the topical and the pellets in bioidentical form, which means that they're identical to your own testosterone and they haven't been synthesized or manipulated in the laboratory to make it not quite match to your system.
Yes, thank you, Dr. Darvish. Okay, now kind of focusing on some of the lifestyle things and supplementation we can do to boost our testosterone naturally. First and foremost, getting enough sleep. The studies show to get about 7 to 8 hours of sleep per night, but I typically like my male patients to get about 8 or 9. I know that's tough in the world we live in today with family and kids and having to get people to school and different projects and stuff like that. But if we could try to focus on getting at least 7, 8 hours a night, that is what I'd like to see. And why? Because when we have a lack of sleep or sleep less than 7 hours a night, it adversely reacts not only testosterone, but a bunch of different hormones in the body and our chemical pathways as well. They did an interesting study at the University of Chicago that found that testosterone levels actually drop in men that don't get enough sleep. Research has shown that just 1 week of restricted sleep, so anything less than 7 hours a night, decreases daytime testosterone levels by up to 15%, which is pretty substantial. And then if you tack on the fact that with normal aging, testosterone levels tend to drop 1 to 2% a year after the age of 30, that could be pretty big amount of testosterone drop for some people. So like I said before, aim for 7 or 8, but I typically like to see 8 or 9. But I know it's tough in the world we live in today. Another lifestyle thing, diets. Huge on how it affects not only testosterone, but other hormones as well. So we want to focus on whole food diets. We want to get a lot of dark leafy greens, high fiber, a good balance of fats, lean proteins, and carbohydrates. These types of diets are essential to maintaining testosterone levels. There's also been a lot of research that's shown that overeating and yo-yo dieting disrupts and lowers testosterone levels as well. There's also a lot of fad diets out there. I don't think they're for everybody. I think we should eat more of a whole foods diet and lots of veggies and lean proteins, but that's a whole topic in and of itself. So not time for today, unfortunately. And then staying active. And I really love this topic because I really love weightlifting and staying in shape and keeping my total testosterone levels high. And so weightlifting, number one, lifting weights is the best form of exercise to boost testosterone, especially when we start lifting heavy weights. And we get an increase in muscle mass from this, and the body starts to produce more testosterone because of it. And not only are we getting that boost in testosterone, but we're also strengthening our entire body, which helps to produce injury, it speeds up our metabolism, boosts our immune system function. So we're just getting an all-around great effect. Another great form of exercise, high intensity interval training, or also known as HIIT. Studies have shown this type of training raises and boosts testosterone levels. I like to do HIIT training in combination with lifting weights. This combination, from some of the studies I've read, will enhance total testosterone levels and produce good heart health. So you're lowering your risk of cardiovascular disease, we're lowering your risk of diabetes, lowering your risk of other those lifestyle-related leading deaths among men that we kind of talked about earlier. Another thing I just want to mention is chronic endurance training, so cycling or running for hours on end. There's a lot of studies that shown that these exercises actually decrease testosterone levels. And why is that? It's just we're having a huge release of cortisol, which we'll hop into in the next couple slides. But and this cortisol typically has the opposite effect of testosterone. Cortisol is not a bad thing by any means, but when it's an excess amount, it can have it's going to adversely affect testosterone. And then we want to shoot for about 150 minutes a week of moderate exercise, or 75 minutes of vigorous aerobic activity. HIIT would be something that's considered vigorous, and some of the weightlifting as well. And then this topic about stress reduction and how it specifically relates to testosterone. This is important, and kind of talking about the last slide I mentioned, cortisol. So cortisol, what is it? It's a hormone released by the body in response to increased stress or threat levels. So why is this a bad thing? Because if this is chronically elevated over time, it can produce erectile dysfunction, loss of libido. And why is that? It's because I said before, it's inhibiting your testosterone production. So when this is chronically elevated over time, not only does it affect your testosterone, it affects your overall immune health, and it wreaks havoc on all of the other hormone and pathways in the body too. So just something to keep in mind around stress, and kind of go into managing that stress with relaxation techniques and mind-body techniques as well.
So cortisol, the way I also see cortisol is it's a catabolic hormone, which means it breaks things down. So when you're trying to build muscle and you're under high stress, or you're, like Dr. Newell was mentioning, you're doing an exercise for 50 minutes or 2 hours, you're actually causing an increase in cortisol, which breaks down the muscle. And that's one of the big issues with cortisol and steroids that are given as injections for joint injuries and other issues, is that it's breaking down the muscle and reducing your testosterone instead of helping you build up.
Yes, thank you, Dr. Darvish. And there's some vitamins and minerals and some supplementation we can go over that have been shown in some research to boost testosterone levels. First one we'll focus on here is vitamin D. There's a lot of good research that has shown that correcting a deficiency contributes to increased testosterone levels. I like to recommend 15 to 30 minutes, preferably 30 minutes a day in direct sunlight if you can get that. I know there's parts of the year here where there is little to no direct sunlight, and we're not getting that vitamin D production. So recommending for some people a supplementation with vitamin D as well. Also, just great vitamin for overall immune system health, and acts as a steroid hormone, which is interesting in itself. But DHEA, another way to boost testosterone levels. It's a hormone in the pathway that helps produce testosterone. It's produced naturally by the adrenal glands and is converted in the body to testosterone and other sex hormones as well. And then some studies out there showing supplementation with DHEA have shown to increase total testosterone levels in the body. Zinc and magnesium, I like to combine the two. Some of the deficiencies in these areas may contribute to a drop in testosterone as well. There was one study I was reading that said just after 4 weeks of supplementation with zinc and magnesium, testosterone levels were increased by about 5 to 10%. Magnesium is found in whole grains and dark leafy greens. Zinc is found in dark leafy greens as well, but also found in flax and pumpkin seeds. That is in no way, shape, or form an extensive list, but just some ideas of where you can find both zinc and magnesium. Tomcat Ali, another one that I like. It's also known as long jack. It's been a traditional part of Southeast Asian medicine for centuries. It increases both free and total testosterone levels. And studies have shown that long jack can improve sperm motility and concentration as well. So for the men out there maybe looking to start some families, those are important factors, absolutely. And ashwagandha, another one I really like, about 500 milligrams, 500 to 600 milligrams a day, has been shown to increase testosterone levels and increase concentration and mood, and increase sperm motility and concentration as well. Dr. Darvish, do you want to go into some of the peptides and progesterone?
Sure. The other one, before actually I forget, is low homeopathic testosterone drops. And what that does is it stimulates the body's own mechanism to make testosterone, as long as you have the building blocks. So it's a homeopathic drops that we do carry here. Peptides, for those of you who don't know what peptides are, they're amino acids, they're chains of amino acids, and they're involved with signaling tissues and hormones and immune system and all sorts of different parts of the body. There's been over 4,000 or 5,000 different peptides that have been discovered. We only have maybe a handful of them that we can prescribe that have been stabilized. Insulin, for instance, was the very first peptide that was discovered in the 1970s. And it is a very powerful way of stimulating the body to make certain substances in the system. So for instance, we can use peptides to stimulate the growth hormones. We can use peptides to stimulate testosterone production. And the reason this is important is because it's a more natural way of your body producing the hormones versus forcing a hormone onto the body. And so if your body gets these signals and it has the building blocks like the zinc and the DHEA and the pregnenolone and the vitamin D, magnesium, then it's gonna make the correct amount of testosterone that your body needs. So it's a very powerful way of treating low testosterone or testosterone deficiency. Oftentimes these are given in injectable forms, where you inject yourself at home, right in the abdomen or in the thigh, a couple of times a week sometimes it's every day, depending on which peptides are most beneficial. The other thing about these peptides is that they keep other hormones in balance. So for instance, giving your peptide to increase testosterone will also help reduce estrogen in the body, which is a big problem with some of the testosterone supplementations directly, is that sometimes some men do have this susceptibility of transferring the testosterone into estrogen, and that's why they still gain those man boobs or the enlarged belly, is because the testosterone is getting changed over by an enzyme called aromatase and making more estrogen. So peptides keep that signaling a little bit more in balance. Progesterone is mostly regarded as a female hormone, but it actually is a very powerful hormone for men. It is the building block for testosterone production. It is a very calming hormone, often used at night, and is increased at night to help us sleep, to help the parasympathetic or the calming nervous system get activated. It helps with bone health. But it is an important hormone for sperm production and for the testosterone production. So sometimes men actually feel a lot better on progesterone than they do on testosterone. Progesterone also helps reduce the estrogen buildup in the body for both men and women. And then there's HCG, which some of you may have heard of this as a pregnancy hormone or a weight loss hormone. It basically can be used to stimulate the body's own testosterone production again, because it mimics the hormones that are released by the pituitary gland, the LH and the FSH, which signal the testes to make testosterone. And that is also typically more of an injectable. Occasionally we'll give it intranasally, but it's not as effective as injectable, and it's often given maybe twice a week. We use these therapies for men who are still wanting to have children and want to get a good amounts of sperm production, because when we do give testosterone directly, it suppresses the sperm production. So these other mechanisms for younger men is a better choice to go.
Yes, thank you. And then just kind of going into eliminating alcohol consumption again, more specifically on how it ties in. I'm picking up some feedback here.
Yes, can I have everybody turn off or put on the mics on mute, please?
Reporting that technical poll was completed.
Okay. So going over alcohol again and how it relates more so to testosterone this time around, kind of just going back over the moderate drinking, 2 drinks a day for men over the age of 65, 1 if you're or under the age of 65, 1 if you're over the age of 65. Heavy drinking is associated with a decrease in testosterone levels, and this is usually 5 or more drinks in a seated period. And why is this important? Because alcohol it's a toxin, number one, and 2, it can destroy and wreak havoc on your testosterone and other hormones in the body. Alcohol damages your Leydig cells in the testes, and these cells are important because they're actually what produces the testosterone. Another way that alcohol lowers your testosterone is coenzyme NAD+, which is used for both alcohol metabolism as well as testosterone synthesis. When alcohol is consumed, like I said, as a toxin, this NAD+ is going to metabolize alcohol to get it out of the body rather than helping to produce testosterone. Alcohol can also increase your cortisol levels, which decrease testosterone synthesis, kind of like I was talking about before, has the opposite effect, the catabolic effect of testosterone. And also, alcohol may increase the conversion of testosterone to estrogen in the body, and that was kind of something that Dr. Darvish was talking about as well. Anybody have any questions or comments, or did anybody keep tab of how many times testosterone was said during this talk?
Thank you so much, Dr. Newell. That was great. Please do remember that anything that was said on this PowerPoint presentation is meant for informational purposes only and is not intended to treat or diagnose you with testosterone deficiency or make a claim. So we do encourage you to seek your own provider and to discuss some of the conditions that you may be dealing with. The other thing, Dr. Newell, that we didn't really mention is IV therapy, including NAD IV therapy, which is one of the best ways to provide some of those nutrients that you were mentioning directly to the cells to help the body not only de-stress and reduce its cortisol, but also stimulate the production of some of these other hormones. So vitamin therapy is a great option.
Yeah, absolutely. And it's amazing how intertwined all this is, and how all the different hormones react in the body and interact with one another. It's pretty fascinating stuff.
And I do want to say that most of what was said about testosterone is just as important in a woman. I do see a number of women being on the call here today, And so I just wanted to bring that up, that testosterone is very, very important for not only physical well-being, for like muscle strength and muscle in the body, which increases the oxygenation in our body and reduces toxicity when we have more muscle compared to fat. But it also gives us the sense of well-being and decision-making for both men and women. So when our testosterone levels drop, which occurs after the age of 35 in men, then decision-making becomes difficult. Same with women. If you're having a hard time making decisions, it's often because there's low testosterone and it needs to be evaluated. So if there's no other questions, thank you everyone for joining us for this webinar. And thank you, Dr. Newell, for presenting. That was wonderful. I do want to remind everyone that we will be on Facebook Live and Instagram Live tomorrow at noon, Thursday at noon, and we'll be answering more questions and discussing men's health from a little bit of a different angle. So please join us. And then next week, we will be discussing women's health and some of the issues or concerns and what we can do with the health, keeping women healthy. So please join us next Wednesday for a webinar, and that email should be going out either Monday or Tuesday, and then a live chat on Facebook and Instagram every Thursday at noon. Look forward to seeing you then, and have a wonderful weekend. Keep safe, and we will see you soon. Thank you so much. Bye-bye.
Thank you for your time, everybody.